Hi, Teresa. You're finally here.
Teresa?
We're here. I took the whole afternoon off so I could be with her the whole time.
Hey, just so you know, the doctor already made special arrangements for this appointment. We don't have all afternoon. This is only going to take like 15 minutes. Hey, I hear you're going to college.
We'll see.
Hey, Dr. Knotright.
Mrs. Bloom, I'm so glad you can make it to this appointment. You must be really excited now that Teresa's finally leaving home.
Well, yes. Well, no. I mean, she wants to go to college, but I'm not ready for her to leave home.
So are we talking about training at one of those adult care programs?
No, actually, I'm going to State University up in College Town to study biology.
Dr. Knotright, thanks for seeing us over lunch so I could be here. As Teresa so boldly stated, she wants to go to State University, and I think she should just go to junior college.
Mom.
Teresa, I don't want you to go off and live with strangers. What if...
Mom, please.
Hey, ladies, whoa, here. Reader's Digest version, please.
I'm going to College Town, and that's not up for debate. We are here because I need you, my PCP, to help me develop a transition plan so I can reach my goal of going to college.
Teresa.
Mrs. Bloom, I've got this. Teresa, I am not a guidance counselor. Maybe you should talk to your IEP people. They know all about that special stuff. Yeah, I'm your doctor. I'm sorry, but I just don't have time for that other stuff. I'm just doing all I can to try to keep you alive. Anyway, I think that we're wasting all of our time talking about this college planning stuff. Do you really think that you're going to study biology? I mean, are you going to be a microbiologist?
You know, Dr. Knotright, this is probably a good time for me to tell you that I'm planning to change my PCP to an adult practice in College Town. You know, I want to start going to a place where there's no Legos in the waiting room.
What's wrong with Legos? And Mrs. Bloom, I don't think that's a good idea. I've been your daughter's doctor for 10 years now. I think I'm finally getting this osteogenesis imperfecta thing down, okay? Where are you going to find another PCP who understands that like I do? You're not going to pull them out of the phone book. There's no point in transition here. I think you just need to stay home, play it safe, don't take any risks, let your mom and I continue to make the critical decisions just like we've always done, okay? Let's keep things status quo.
If you Google healthcare transition, there's a lot of research on this.
I assure you, I use Google plenty for medical information, but patients are always coming in here thinking that they know more than a doctor because they read something online. You know, if you want to take some classes, maybe you should take some online classes.
But Doc, I found some really good resources online at gottransition.org, like a checklist to help guide me. And now I know there are certain processes that we need to go through to make sure I have a smooth healthcare transition plan.
We? When did you go to medical school?
No, we, as in me, the patient, you, the PCP, all of my specialists, my whole medical home team.
What team? Your specialists don't include me in their decisions, and I don't include them in mine.
No, this is about me setting and reaching my life goals and my healthcare goals. It's about my medical home guiding me through a smooth healthcare transition plan.
All right, maybe you've raised some good points, though confusing points, but we've run out of time. So if you really want to pursue this transition plan, you're going to need to schedule another appointment with Cindy. But remember, I'm your healthcare provider. This goal planning stuff, I leave that to the people that are paid to do that, okay? Goals.
If you are a patient, come prepared to your healthcare transition appointment. Demonstrate to your medical home team that you value shared decision-making. Follow up with your healthcare provider regarding critical next steps to assure adequate transfer of information. If you are a family member, empower your child to be a wise healthcare consumer. Understand that healthcare transition is a lengthy process, so start early with small steps that support independence. Discuss with your child how decisions will be made regarding health and wellness. If you are a provider, be proactive Set up a healthcare transition appointment. Honor the cultural norms and family dynamics of your patients. Check in with the patient themselves to be sure they are informed and confident following the transfer of care. For additional tools, resources, and information about youth healthcare transition, visit us at www.gottransition.org.